As we are now in the holiday season and people are getting ready to celebrate with their family and friends, doctors have a warning because of a phenomenon that happens around the winter holidays as heart attacks significantly increase during the winter holiday months. So let's bring in an expert on this subject, Dr. Fahmi Farah, invasive cardiologist. Thank you so much for joining us tonight.
Thank you for having me. It's my pleasure.
So, Dr. Farah, why is it that this phenomenon happens? What could be some of the contributing factors, and how much of an increase do we actually see in heart attacks this time of year?
We do actually see a significant increase in hospitalization in general and ER visit, and part of that is due to heart attack as well as heart failure. It's a multifactorial, phenomenon. Usually during the holiday season, people tend to be stressed. They deviate normally, from their normal routine. They eat more unhealthy foods. There's increase in alcohol intake, and then the flu season also around the same time. So all of this together contribute to these statistics.
And furthermore, I mean, what is your understanding on this holiday heart attack phenomenon? Is it really that big of an increase given the holiday season versus the other times of year? How much of a difference are we seeing here?
In my opinion, yes, it is a significant difference we see. And it's not just heart attack, it's also a subset of patients, heart failure patients, people who have pre-existing congestive heart failure. When they have the unhealthy food, especially the high sodium content that tends to be in the holiday season food, when they eat that, they go into acute heart failure and they start having symptoms like shortness of breath and swelling, and they end up in the emergency department. So we see quite a few of them.
And other factors, like you mentioned, stress, also eating. And a lot of times people having heart attacks might not even realize that what is exactly happening to them. What are some of the things that heart failure or heart attacks can be mistaken for, and how can you tell the difference?
Oh, absolutely. There's a phenomenon called atypical symptoms when it comes to heart attack. A lot of people can have no chest pain at all. Sometimes all they can have are GI symptoms like indigestion, nausea, vomiting. And during this time of the year, a lot of people tend to attribute that to unhealthy eating, and they delay their care. So that is a problem.
So what exactly can people look out for that would indicate that they are having a heart attack, not maybe some of these other issues that they might mistake it for? What are really the triggers that you would look for when somebody comes into the emergency room?
Well, first of all, for people who are trying to decipher between whether this is a heart attack or not, like if you're having profuse sweating along with nausea, vomiting, that is a sign of atypical sign of a heart attack. You should definitely seek help and go to the emergency department. And when those folks come to the ER, we do have a protocol. We usually do an EKG right away, and the EKG tells us a lot of information. If they're having an acute heart attack, we will know right away just by looking at that EKG. We also run some other tests, such as some lab tests where we check for something called troponin. It's a very specific enzyme that is released when somebody's having a heart attack. It's released into their bloodstream. So it's just with a simple lab test, we can tell if this person's having a heart attack or not. And once we determine that, we initiate, the acute care where we take them to the cath lab and actually perform a minor procedure where we open up that blockage and put a stent in, and that's a life-saving procedure.
And that's why it's so important to get to the hospital as soon as you start feeling those symptoms so the experts can take care of you right away. Any other tips for people as we get into the holiday season? How can they avoid some of these things that might contribute to this heart attack phenomenon?
I would say, of course, stress management is important, but also not deviating from your routine. For instance, if you're somebody who has pre-existing heart conditions, make sure to not skip your medications and take your medications in a timely manner. Same thing with vaccinations. Flu is a major contributor to heart attacks, and so I would advise everybody to not skip the flu season, flu vaccine this year. And moderation is key. I of course want everybody to enjoy the holiday season, but make sure you're drinking in moderation and that you're enjoying those holiday foods in moderation.
Some great tips that could also keep us healthy all year round. Thank you so much, Dr. Farah, a cardiologist, lending her expertise here on the trend of heart attacks actually increasing during the winter holidays. Thank you so much.
Thank you for having me.